welcome to Docplexus News. Let's go through this week's healthcare headlines that matter. The Delhi High Court has sought reply of the centre on a plea demanding CBI probe into the alleged allegations in National Eligibility Entrance Test 2016. Dr. Anand Rai, the whistleblower of Weapon Scan, has alleged that Delhi police is acting like a post office and is still awaiting to receive technical data from National Board examination. The court said this is a very serious matter. Therefore, the authorities need to file their status report or response in 1 week. Supreme Court has sought reasons from private universities in Puducherry that have failed to allot seats to meritorious PG students despite the directions from Medical Council of India. In this regard, the court has also issued a notice to Medical Council of India, University Grant Commission and Human Resource Development. The plea of medical students has alleged that these institutions had admitted students illegally and government had not forwarded the names of meritorious students. Taking concerns of the increasing number of deaths, the Union Health Ministry has directed the Delhi government to set up designated swine flu wards in hospitals. The government also needs to ensure that all the chemists in the city should maintain the stock of necessary medicines to combat such diseases. The Gorakhpur tragedy has once again thrown spotlight on a lack of specialists, nurses and healthcare workers. To combat the situation and to avoid such instances in the future, the Health Ministry is planning to recognize certain diplomas from reputed institutes. Such diplomates, along with an MBBS degree, will be given a tag of specialist. The risk of heart attack and stroke can now be spotted earlier as scientists from Warwick and Monash University have developed a new diagnostic tool. They have observed that increasing the wavelength of currently used infrared radiation could improve the sensitivity of plaque detection. According to the researchers, this innovation can detect the threat of imminent heart attack and thereby reduce the mortality. A simple and cost-effective tool has been developed to identify patients at high risk for hypoglycemic emergency. The US FDA funded the development of this hypoglycemia risk stratification tool. This tool uses only 6 inputs from patient data and does not require patient contact. This tool will strengthen doctors' role in management of patients with type 2 diabetes. The government is all set to launch the Hridam program for management of patients with congenital heart diseases. Through Hridam, the health department is in the process of linking MOU with 3 private hospitals for treating congenital heart problems. As per this program, a beneficiary will have to register at the Hridam website, following which the impaneled institution will inform about the surgery dates. The Doctors Association in Tamilnadu recommends that the state government does not need to seek permission from the Medical Council of India for increasing MBBS seats. The statement came after the Supreme Court asked the state and the Medical Council of India to make a balanced decision on the state government's demand of increasing 2,500 MBBS seats. Association General Secretary Dr. G.R. Ravindranath said that the state must seek only Health Ministry's permission to increase the seats. The World Health Organization has congratulated India for launching the world's biggest vaccination program against measles and rubella. Under this campaign, India aims to vaccinate 410 million children in the age group of 9 months to 15 years over the next 2 years. The first phase of campaign has already been successfully completed in 5 states. The next round is starting in 8 states and aims to cover 3.4 crore children. Out of the 20,000 IVF clinics across the country, only 20% are registered with the ICMR. A senior official from ICMR has told that a comprehensive ART registry will be the first step to comply with the rising demand for IVF and to bring transparency in the cost and the quality. In the absence of a detailed regulation, a grey market of unprofessional ART clinics are operating, taking advantage of couples looking to have children. Dr. K.H. Sancheti, the founder of Sancheti Institute of Orthopedics and Rehabilitation, was awarded Maharashtra's most prestigious Padma Bhushan Award on 27 August 2017. He is the recipient of country's highest civilian awards, Padma Shri, Padma Bhushan and Padma Bhushan for his exceptional service to humanity in the field of orthopedics. Moreover, he is widely acknowledged for a novel knee and hip transplant prosthesis called the Indus. Docplexus is extremely thankful to its community for sharing practice tips. Dr. Radha Raghavan has nicely explained the importance of doctor-patient relationship. According to her, for successful practice, a doctor should not shout at patient, should never shy for taking clinical history and should explain the given lab test in a simple way. This was the best practice tip for the week. You can also share your tips by commenting below. These were the latest happening in the medical field brought to you by Docplexus, India's largest and fastest growing online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!